Bismillah ar-Rahman ar-Rahim. As an important part of taking the medical history from our dental patients, medications use is an important aspect that has to be covered thoroughly during taking this history. And there are three main aspects that make taking the drug history or the medications history from our dental patients an important topic. The first aspect is that the medical history and diseases may have implications for the oral condition and subsequent delivery of dental care. So we may have different implications for the oral condition, as we will see examples later. This will affect the delivery of dental care and how we are to modify the patient's treatment plan. Another important aspect is the oral complications of systemic medications, as many medications taken by our patients have certain oral complications or oral side effects. Therefore, they may have or they may be associated with a risk of oral disease, and they may predispose the patients to oral diseases that have to be addressed. Another aspect is that there could be some potential interactions between the medications taken by the patients and the medications that are prescribed within the context of dental practice. So all of these three aspects are going to be addressed thoroughly in this lecture. So let's start first by talking about the dental considerations of drug history. We have five main considerations. These will be discussed throughout two lectures. So the first lecture we are going to describe the oral side effects caused by medications, and also the indications of medical conditions by taking the medications history, and also how the current medical conditions and medications impact dental care. In another lecture, we are going to discuss the pharmacokinetics and its impact on dental management, and also how the dental prescribing could be affected by the current medical conditions and medications taken by our patients. So let's first discuss the important aspect of oral side effects that are caused by medications. Now, we have different types of oral side effects of medications, like, for example, xerostomia or dry mouth, fungal infections or candidiasis, for example. We have also mucositis, tooth discoloration, dysgeusia or abnormalities of taste. We have gingival enlargement, lichenoid reaction, and mucosal burns. These are some of the common oral side effects of medications. So xerostomia or dry mouth is actually caused by many diseases and by many factors. However, medications use is the most common cause of xerostomia. So if your patient attends or presents with a chief complaint of dry mouth, the first question you have to ask the patient is, what medications do you take, or are you currently taking any medications? Actually, dry mouth is listed as an adverse effect for over 500 medications. So this is a common side effect, and it could be treated and it could be addressed if the medication is identified and proper, and it is replaced by another appropriate medication. Now, the different medications that cause dry mouth, as you can see, there is a long list. We have anticholinergic drugs like, for example, tricyclic antidepressants. We have also antihypertensive drugs like beta blockers, diuretics, ACE inhibitors, calcium channel blockers. We have antihistamines, we have sedative hypnotics, opiates, muscle relaxants. We have chemotherapeutic agents, including cytotoxic drugs and cytokines. We have retinoids, thyroid supplements, anti-HIV medications. So as you see, many of these medications are actually used frequently by our dental patients, like for example the antihypertensive drugs, the antihistamines, the anticholinergic drugs. Now, another side effects or oral side effect of medications is candidiasis. Actually, candidiasis may be caused or predisposed to by two main categories of medications, which are the broad spectrum antibiotics and corticosteroids. Now, the broad spectrum antibiotics, I just want to mention a few of them, which may also be prescribed to our dental patients, like the tetracyclines, mainly tetracycline and minocycline. We have also metronidazole. We have amoxicillin. It is said that these drugs predispose to candidiasis because they affect the adhesion of fungi and also the nutrients. Now, the corticosteroids, on the other hand, are used as, for example, anti-inflammatory agents, and these, because they suppress immunity, they predispose to candidiasis. Of course, we not only include corticosteroids, but other anti-inflammatory or anti-immune immunosuppressant drugs can also predispose to candidiasis. Like you can see in this child here, we have pseudomembranous candidiasis. Another oral side effect of medications is ulcers. These ulcers could be abscess-like and non-abscess-like, meaning that they could be similar in shape to apathy, like being oval or round, surrounded by a reddish halo. And actually, we have also a long list of medications that cause these ulcers, like, for example, NSAIDs and several chemotherapeutic agents. Now, another important oral side effect of medications is lichenoid reaction, which is a sort of hypersensitivity reaction. And it is said that the active thiol groups found in the chemical structure of some medications, like piroxicam, sulfasalazine, and glipizide, these predispose to the lichenoid reactions. Some of the most commonly implicated drugs in lichenoid reactions include NSAIDs, antihypertensive agents, antimalarials, antimicrobials, and also hypoglycemic drugs. So the lichenoid reaction is seen here as whitish striations associated with red erosive areas. Now, gingival enlargement also is another oral side effect of medications, and it is typically caused by three main categories of drugs, like calcium channel blockers. The typical example is nifedipine. The anticonvulsants, a typical example is phenytoin, and immunosuppressants. A typical example is cyclosporine, which is given to many patients who have organ transplant. Now, angioedema also is another oral side effect caused by certain medications, like, for example, ACE inhibitors used for hypertension and heart failure. Now, oral pigmentation is another oral side effect, and it is caused by one of two main mechanisms, either the metabolites of some medications may be deposited in the oral mucosa, and these chelate with iron and melanin. A typical example is tetracycline, minocycline, and also antimalarial drugs. The other mechanism for causing this pigmentation is that they cause stimulation of melanocytes. So, minocycline, for example, is a very important antibiotic that is given for many patients with periodontal disease, for example, and it may cause tooth discoloration as it binds to calcium ions via chelation to form an insoluble complex incorporated into the tooth matrix and then causing pigmentation. A very serious complication or oral side effects of medications is osteonecrosis. And the classical example for osteonecrosis caused by medications is by bisphosphonates. These medications are usually used to treat osteoporosis, either related to the postmenopause or, for example, in some patients who take cancer therapy. These cause osteonecrosis, abbreviated as bisphosphonate related osteonecrosis of the jaw. These cause osteonecrosis because they are anti-resorptive, meaning that they slow the bone turnover and remodeling, therefore increasing the bone density, and also they are anti-angiogenic agents. Therefore, they predispose to osteonecrosis. Now, another oral side effect is taste abnormalities, which can be in the form of reducing the taste sensitivity, like or also called hypogeusia. And we have also abnormal taste, which could be either metallic taste or bitter taste. This is called dysgeusia. We have many drugs that cause taste abnormalities, chemotherapeutic agents, antihypertensive drugs, and antimicrobials, like, for example, the antibiotic that we sometimes prescribe to our patients, which is called metronidazole. The tongue also can be affected by drugs, causing certain problems, like, for example, glossitis, edema, discoloration, and burning tongue. For example, here in this patient who takes iron supplements in the form of syrup, constantly taking this syrup, therefore she developed a black hairy tongue. The second aspect, after finishing now with the oral side effect of medication, we are going to discuss how the medications may indicate if the patient has a certain medical condition, because sometimes our patients are not aware of exactly the medical condition they have. So telling us the medications that they take may also explain what are the medical conditions. So it's very important to know what medications the patient uses and why, and also take an appropriate history from the patient about using over-the-counter medications or herbal products. The third important aspect is how the current medical conditions that the patient has and also the medications they take impact dental care. So this means that we may have to modify the dental treatment plan for our patients and also prepare ourselves for any emergency problem that may develop during dental treatment. So the patient's drugs should be categorized in order to identify the immediate safety considerations. For example, a patient who takes nitroglycerin or takes certain inhaler, this means that the patient has either ischemic heart disease or has, for example, asthma. And also, we should be aware of any drugs that may complicate the dental treatment, for example, insulin, which may cause glycemia, and also any drugs that may complicate the treatment outcomes. An example is prednisolone and bisphosphonates, which means that these drugs that the patients use may cause certain complications, like for example for prednisolone may delay wound healing, and for bisphosphonate may predispose the patient to osteonecrosis after extraction. So it is very important that we have a little background about the common medications that the dental outpatients use. And talking about the most common medications is actually what are the most common medications used by the public, because the public reflect the dental patients, or the dental patients on the other hand reflect the general public. So our patients use different kinds of medications. However, the most common medications used are most probably anticoagulants and antiplatelets. We have also antihypertensive agents. We have hypoglycemic drugs, antidepressants, analgesics, thyroid medications, contraceptives, antihistamines, and also immunosuppressants. Among these, actually, the most three categories of medications that have to be covered by taking the necessary precautions. These are the antiplatelet, anticoagulant drugs. We have also corticosteroids and bisphosphonates. Each one of these needs to be addressed by designing an appropriate treatment plan for our patients so as to avoid certain complications. So let's start first by oral anticoagulant and antiplatelet medications. We have anticoagulants such as warfarin. We have also direct acting anticoagulants like Pradaxa, for example. And we have also antiplatelet agents. The typical example is aspirin, but we have other antiplatelet agents like, for example, Plavix. Now, let's talk a little bit about direct acting anticoagulants. These are actually they may probably have better treatment outcomes in certain patients than warfarin, because they are targeted in action, they are given as fixed doses, they have more predictable pharmacokinetics and shorter half-lives, and they require little or no routine monitoring, and they have fewer drug or food interactions. Now, if our patient is taking direct acting anticoagulants, we should know that usually bleeding following the dental procedure is generally mild. It is controlled by local hemostatic measures. Therefore, we can maximize the time between the last dose of the anticoagulant and the dental intervention as an extra precaution. Warfarin is another story, because warfarin has different pharmacokinetics than these drugs. It is a vitamin K antagonist, meaning that it will prevent or it will act in reducing the synthesis of certain coagulation factors. Now, the effect of warfarin, the therapeutic effect of warfarin, is measured by the International Normalized Ratio, abbreviated as INR. This is a measure of the patient's prothrombin time divided by the laboratory control or normal value of prothrombin time. Now, usually the INR is more than 1 in patients who take warfarin. Now, as precaution for any patient who takes warfarin, we have to measure the INR for this patient on the same day of surgical procedure. We may have two types of procedures, either simple tooth extraction or invasive surgical procedures. Now, in case of simple tooth extraction, which means that we expect that it is not going to be surgical extraction, the INR should be 3.5 or less. And in addition to that, we should use local hemostatic measures. However, if the patient is expected to have invasive surgical procedures, this should always be discussed carefully with the patient physician, whether we need to reduce or to cut warfarin before the surgical procedure. Coming now to antiplatelet therapy for patients who take antiplatelets, they rarely cause problematic bleeding following minor surgical procedures. However, we should follow local hemostatic measures by, for example, using local hemostatic agents like Surgisil or bone wax or other local hemostatic measures such as gel foam. And we can use tranexamic acid mouthwash, local compression with gauze. We can use also suture. These are just some examples of the local hemostatic measures. Now we come to corticosteroids and how these are implicated in dental management and how we are going to modify the dental treatment in order to avoid complications arising from corticosteroid treatment. Now, patients on corticosteroids generally have decreased resistance to infection and they have poor wound healing. Therefore, we have to treat all sources of infections intraorally, eliminating caries or cavities, periapical infections, abscesses, periodontal diseases like gingivitis and periodontitis. And we can follow conservative atraumatic aseptic surgery to reduce the chances of infection and also consider perioperative antimicrobial prophylaxis. Another important aspect to consider in patients who are on corticosteroids is the suppressed pituitary adrenal function. Now, the suppressed pituitary adrenal function is actually correlated with the length of treatment with corticosteroids, the frequency and route of administration, the type of glucocorticoid. Now, a good guideline is to assume that any patient who has received 30 milligram of hydrocortisone or its equivalent for 4 or more weeks, or who has taken 80 milligram of hydrocortisone for more than 2 weeks, has some degree of adrenal suppression. However, the evidence-based research indicates that patients with glucocorticoid-induced adrenal suppression are at an extremely low risk of acute adrenal insufficiency as a result of routine dental treatment, whether it is simple or surgical extraction or other surgical types of treatment. However, the general precautions for patients with glucocorticoid-induced adrenal suppression who are going to receive any dental treatment is the first one, there is no need for steroid cover. And second, the appointment should be in the morning so that the circulating cortisol concentrations are the highest. And also they are instructed to take their usual dose of corticosteroids within 2 hours of the procedure and consider using measures to reduce anxiety such as using sedation. In the case of invasive surgical procedures, like for example, removal of impacted teeth, bone resection, quadrant periodontal surgery, lengthy procedures which are more than 1 hour in duration, and procedures that may cause considerable blood loss, or any procedure that's done under general anesthesia, we can use certain supplementation regimens, like for example, adding a single dose of additional steroid like dexamethasone 6 to 10 milligram, or we can increase the preoperative steroid from 1-fold to 3-fold, then taper over several days. However, the most common choice is to not change the steroid dose at all and use sedation and quality pain control. The last category of medications that we are going to talk about and how these are going to modify or to be considered during designing the treatment plan for the patient is bisphosphonate. Now, prior to taking any bisphosphonate treatment, these patients should be sent for dental assessment in order to treat any sources of infections or to treat any dental problem, so that the patient doesn't have to see the dentist for any therapeutic procedure during taking these bisphosphonates. Now, if an extraction is required during preparation or preparing the patient for taking bisphosphonate, this should be as atraumatic as possible. And postoperatively, antibiotics should be prescribed in the form of amoxicillin or metronidazole for 7 days, and consider antiseptic mouthwash such as chlorhexidine until healing of the extraction wound occurs. Now, before discussing the medication related osteonecrosis of the jaw and how this is treated, we have to explain the different stages of osteonecrosis of the jaw, because treatment will depend upon these stages. The stage 1 is the non-exposed bone variant, and then we have the from stages 1 to 3. There is exposure of the bone. There is exposure and necrosis of the bone that may have no evidence of infection, and then in stage 2 and 3 there is evidence of infection, and in stage 3 there is going to be certain disease outcomes such as pathologic fracture, extraoral fistula, oral antral communication, and also osteolysis extending to the inferior border of the mandible or sinus floor. Now, the treatment depends really upon the disease staging. In stage 0 and 1, the patient is usually treated by analgesics, chlorhexidine mouthwash, and antibiotics for the acute episodes of infection. In stage 3, there is going to be resection of jaw together with stage 0 and 1 treatment. If stage 2 or stage 3 treatment is required, we have always to consider malignancy as part of the differential diagnosis. That's all for dental aspects for medications use by the dental patient. The second part is going to address another important aspect in the second lecture. Thank you.